Chapter 5, Healthcare System. Talks about the healthcare timeline, managed care, and managed care program for pharmacy tech. So first they're going to talk about managed care. And managed care refers to techniques intended to reduce the cost of health benefits and to improve the quality of health. The cost of health care has increased 2,500% in the past 30 days, or 30 years. Sorry, that would be terrible. 2,500 in the past 30 years. Also know that managed care is offered and managed by the insurer. Managed care is offered and managed by the insurer. And that's all. It's just insurance. Techniques. Most characteristic is a network of healthcare providers. These networks include selected providers, specific standards for selecting those providers, quality improvement programs. In other words, to get on some lists as part of a network, you have to have things go right. You have to do some reporting. Sometimes they will even offer you money to stay in these managed care because they are going to offer benefits at a cheaper amount. So that is managed care. Managed care remains widely debated. Proponents argue over the claimed increase in efficiency and improved standards. For-profit managed care has been unsuccessful and has led to higher costs of health care and increase in the amount of people that are uninsured. And that is how everybody feels about the managed part. There are 4 major managed care programs in the U.S. You've got your HMO, Health Maintenance Organization, your Independent Practice Association, Preferred Provider Organization, and your Point of Service. We would define those here. Your Health Maintenance Organization, or HMO. Remember what I have underlined. Patients pay a fixed amount for a periodic fee or medical care from providers belonging to the HMO. Most of the time you have something wrong with you, and it doesn't matter what the circumstances is, from the worst severe to the least, it's going to be a certain price. So they call that HMOs. And doctors agree to these certain prices so that they can have discounts, have people to work on. They make money as well, but they have to agree to this amount. Independent Practice Association, IPA. It's a legal entity that contracts with a group of physicians in order to provide service to HMO members. Physicians are normally paid on a basis of capitalization, which is fixed fee per patient. Kind of the same thing, but it's actually the doctor is getting paid straight instead of us paying the insurance and then the insurance paying the doctor. It kind of goes to the doctor itself. Through the HMO, though. Physicians that participate in IPAs may also serve patients that are not associated with managed care. So they can treat other patients that's not signed up for that HMO. Preferred provider is contractual arrangements which provide services at a discount to a volume group of patients. And most of the time, this is what we have at our jobs. Because they have, 2,000 employees, we get a better rate on insurance. So they offer that rate back to us at a discount. A lot of times we're having to pay 20% of whatever's going on, but that is your PPO. And most of the time your preferred provider is actually an organization that is around your area or that your company wants you to use, and those will most of the time be the cheapest. When you go out of your preferred provider region or area, you might have to pay more. Then you have your point of service. That's when you go in, you have service and you pay. That's all that one is. We have a lot of walk-ins that are wonderful, that people who don't go to the doctor so much, but then something goes wrong with them, they can walk in there. So they call that the point of service.